My name is Chantal Goneau. I'm a physiotherapist at the Independent Sports Medicine and Physiotherapy Clinic or Center. And today I'd like to talk to you about soft tissue release techniques. So what soft tissue release does is it helps to improve blood circulation in a muscle or a soft tissue. It helps to decrease tension in the muscle soft tissue. It helps to facilitate stretching and also improve motion of the muscle and fascia in the body. So when would you use these techniques? You can do it before you play a sport or do an activity to help warm up the tissue, help prepare your muscle for the activity or the sport. You can also use these techniques after an activity or sport if you want to work a little bit more on your mobility and just relaxation. Also helps, like I was mentioning, it helps to facilitate a stretch. So releasing your soft tissue, your fascia before a stretch is helpful. And also if you're a student or you work at a desk for long hours every day, muscles in your neck, your back, even your hips and legs can get stiff and sore, achy, tight. So it's a good time to take a break and regularly, daily try to release these muscles. How it works is you can use a ball, like a yoga ball, which I have here. This is kind of a soft tissue or trigger point release ball. And I have yoga balls here in a little mesh bag. So how you can do it is apply pressure on a tight sore area in the muscle and just hold the pressure. It could be for 10 seconds or more, depending on how sensitive the tissue is and how much tension there is in the tissue. You can also apply pressure on a sore tight area and then stretch the muscle. So you can be a little bit more specific in releasing the muscle or the tissue. Another way you can do it is using a foam roll, which I have over here, and I'll show you in a minute how to release, for example, your back muscles and also stretch your spine a little bit. You can use the foam roll and even a stick, like a myofascial release stick, is helpful for different muscle groups, like your legs. You can use the stick or the foam roll as well. So I'd like to show you 3 exercises to help release the neck, upper back, and spine. So the first is using yoga balls, or you can even use tennis balls. That works as well, as long as they're good quality. And these are in a little mesh bag. And you would put these balls at the base of your skull and find where it's tight and sore in that area, and then just apply pressure and just let yourself relax and until you feel release of the tension and a little bit of relaxation and relief of the muscle pain. So for example, I'll just show you, I'll lie here on the floor. So using the little yoga balls at the base of your skull, and you can use your hands just to position it properly and position the balls on where it's tight and sore. You can press with your head to increase pressure. So if you want a little bit more pressure on the trigger points or the tension, you can just hold the pressure until you feel some relief or release. Or you can move your head side to side and up and down. So if I find a spot here at the base of my skull on the right side, I'm just applying pressure. And sometimes you can get a little bit of a referred pain to the head, which can happen if the trigger point is active and if there's a lot of tension. So I like to move my head up and down to help release that area, and then I'll go side to side. So you can do this for a couple of minutes every day. Now another way to release, and this you can use these balls and do all the muscles along your spine, your neck, on either side of your spine. So don't go on bone, but go more on the muscle on either side of your spine. And then to reach the base of your neck, which is a little bit more difficult, or even your upper back, the back of your shoulder, the back of your shoulder blade, what I do is I take a sock and I put my yoga ball inside. So let's say I want to release, the base of my neck on the left side here. We'll just put the ball right there and then lean against the wall. And again, you can just apply pressure and hold for 30 seconds or 10 seconds or more. And then again, just move slowly by moving your body in different directions, bending your knees to find where it's tight and sore, and then hold the pressure. Or like I said, you can just move around a little bit. So you can do the back of your shoulder this way, back of your shoulder blade and the base of your neck, which works really, really well. So holding the sock, you're sure the ball's not going to fall to the floor, so it's easy to handle. And yeah, so right here I find a little spot, so I just kind of hold the pressure. You can even move your head, so let's say I want to be a little bit more specific and really get a good stretch through that area. I can move my head sideways, I can turn it. It gives me a little bit more kind of localized stretch right where the trigger point is. Now the third exercise I'd like to show you is more to release the muscles along your spine, especially your upper and mid back. It also helps to give a little stretch through your spine using the foam roll. So if I lie here on my back, so you can bend your knees, hands behind your head to support your head. You can drop your elbows a little bit to get a stretch through the shoulders and chest. Tuck your chin a little bit just to protect your neck. And then you can lift your hips a little bit off the floor, it's maybe an inch or so. And then use your heels to push and pull to roll your thoracic spine or your upper mid back from the base of your neck all the way down to just below the shoulder blade. And then you pull, so nice and slow. Try not to arch your low back, so you keep your low back kind of flat. Your abdominals are tight. And just push and pull just up to the base of your neck. So as you're rolling down this way, as the roll moves down towards your feet, you can think of arching your spine over the roll a little bit. But again, without arching your low back. And nice and slow again. You can do 10 repetitions or 10 to 15 once a day. It's a great way to release that area after sitting for hours on end. But it's good to get up from your chair every 30, 60 minutes just to change positions and work on these soft tissue release techniques. All right, so hopefully these exercises are helpful. So let us know if you have any questions or comments. Thank you.